Hello, my name is Lacey Andreessen. My pronouns are she, her, hers, and I currently serve as the Deputy Director for ODHS Child Welfare, aligning program and practice across the state. Last year, the Child Welfare Executive Leadership Team, in partnership with community partners, staff, people with lived experience and expertise, and tribes, created and implemented the Vision for Transformation. Since that time, I've been virtually traveling across the state to meet with teams to talk about the Vision for Transformation in action in each district. And I'm excited today to have the District 6 leadership team, as well as some community partners with us from Douglas County. Would you all introduce yourselves, please?
Hi, I'm Desta Walsh. I'm the district manager with the Department of Human Services in District 6, which is Douglas County.
Hello, everybody. Jessica Hunter, she, her pronouns, the program manager here in District 6, Douglas County Child Welfare.
Hi, everyone. I'm Nadia Haider, she, her pronouns. I am the executive director with the Children's Public-Private Partnership, CP3.
Hi, and I'm Lisa Saldana, she, her pronouns. I am a senior scientist at Oregon Social Learning Center and delighted to be here today to talk about a program that we've been partnering with District 6 on called the FAIR program.
Thank you all. Douglas County is a demonstration site for family preservation, as well as a place where we're implementing both CP3 and the FAIR program. Can you tell us about implementing family preservation and what that looks like in your district and how you see it in alignment with the Vision for Transformation, please?
Sure. So we were excited to be chosen as an implementation site for family preservation that I think we've known, of course, for a long time, that children are more effectively long-term outcome-wise served in home rather than out of home. So we know that it's necessary in some situations to have children placed outside of home, but we're really looking forward through the family preservation work to get to the point where we're serving more children in home than we're serving out of home, and really kind of shifting the way that we work in alignment with Vision for Transformation. Particularly around the first guiding principle of engaging communities and families differently than we have. So really the foundation for supporting family preservation is around the plan to engage children and families that present with safety threats, to develop the resources to kind of broaden our scope of what we're providing to keep children in home. So we've done a lot of work to prepare that way, and we're excited to have our partners here to talk about what their experiences have been with that as well with us.
Thanks, Nesta. So Jessica, anytime we're looking at asking our teams to learn and do differently, that always comes with the need for additional training and support. And so can you talk about how we're preparing staff for utilizing a family preservation approach?
Yes, I'm happy to do that. It's great to be here with this fabulous group of people. So we are setting a new standard here in D6 as to how we work with parents and share power and how to center families in our decision making. And we're excited about our goals and the journey itself, and bringing our staff along in this journey and achieving as a team all of our goals related to family preservation work. An example of how we're making our Vision for Transformation goals a reality is our active recruitment of parents to be a part of our hiring process. And the way that staff development ties into that is having our staff work side by side with the parent in the interview and hiring process provides for a real opportunity to re-examine values around the work and our values around who holds power, who's making decisions. So it really moves us forward in our change culture that we're currently actively involved in. So we're very excited about the opportunity for staff to have that hands-on experience that really just connects nicely with the training and development they're doing with Aaliyah and some of our other external partners. And it's a real opportunity to apply the things we're learning. Also to our case staffing and decision-making process. So as we shift away from serving children in foster care and serving them in their home environment, we are imagining new ways to utilize staff, both on the self-sufficiency and the child welfare side of ODHS. So there's some planning and development and great discussions happening there. And we're taking on the work of identifying gaps that exist in roles and responsibilities as they're currently defined in our staff. We are also, I'm pretty excited about this, we're anticipating a need to support staff in their humanness as well, as we're anticipating shifts in how self-sufficiency and child welfare staff work with families and work with each other. We see a need for staff to have a safe and productive place to process what's coming up for them and getting in the way of good engagement.
Thanks, Jessica. It's great to hear, because that what you're describing, really enhancing your staff supports, training, and infrastructure for them, is directly aligned with the guiding principle 2 of the vision. So excellent to hear. So we also have Lisa and Naja with us today to talk about some of the specific efforts around where we're partnering to put the vision for transformation into action. Let's talk about that.
Thank you for this opportunity and for inviting us to join this conversation. This is really exciting. To understand the Children's Public-Private Partnership and our role, it's important to understand our genesis. So CP3, or the Children's Public-Private Partnership, was founded on the conviction that the complex challenges our youth, families, and the child welfare system are facing cannot be addressed solely by the state. They require ownership by all Oregonians. And it was moved by this conviction that a group of Oregonians in 2018 reached out to ODHS leadership and asked, how can the community step up and help support our children and families? So after a series of discussions, ODHS identified that where some really great partnerships are in place on the prevention end, more work was needed on towards getting kids out of the foster care system and transitioned into permanent homes. And that was an area that they wanted to figure out new partnerships, new ways of partnering with the community. And that became our focus. So in late 2019, these 5 Oregonians who'd reached out to ODHS established CP3, Children's Public-Private Partnership, as a nonprofit, and ODHS on their part established a project team called CP3 Achieving Permanency within the ORAE team in the central office, which is the research and implementation team. This is a partnership which is data informed to identify what are the key barriers that are keeping kids from exiting foster care. And then another key principle we're using is mobilizing collaboration between the community and child welfare, or actually together with self-sufficiency, so with ODHS. And those are 2 key tenets. Use data to figure out how to make your way through all that exists, and then reach out to community in an intensive manner to get their thoughts into the process, to get their collaboration up front. And our goal is to safely reduce the number of children and youth in foster care. We first piloted this approach in Marion County in early 2020, and Douglas County is our second pilot site. Based on these research results and community input, Desta and Jessica have prioritized lack of stable housing and lack of support for in-home child safety as the 2 barriers where they want community support, and which are the barriers to children achieving permanency. Therefore, working closely with child welfare and reaching out to the community, we are pulling together input from stakeholders in the community on both of these issues. And the way we're doing it is basically talking to anyone and everyone who has anything to do with any of these 2 issues. So we're talking to, of course, parents with lived experience. We're talking to practitioners, advocates, community leaders, just generally anyone associated with the topic. And in these conversations, we are trying to understand the issue from each one of their unique perspectives, because that starts painting the picture from all sides. And we are also in the same discussions surfacing what are their ideas? What are some things that have worked already in the community? What are some things that they want to try bringing into the community? And so you start understanding the issue and you start understanding the community's ideas on how to address the issue. I should mention that CP3 is not a service delivery agency. We work to identify partners locally who, organizations and people who are interested in collaborating and building on what's already in play in the community, and then working together with them and with child welfare to figure out how to design new or replicate existing models and bring them into the community to address the barriers that are keeping kids from moving into permanent homes. And then in the implementation phase, we work with the ORA team and with child welfare to make sure there's integration between child welfare and the new model that's working in the community, track results to make sure we're headed towards the right direction. And I should also mention that this ties very closely with two key desired outcomes of the Child Welfare Vision for Transformation. One, fewer kids in foster care, and second, more kids served in home and fewer kids in substitute care. And with that, I want to hand back to you.
Thanks, Naja. And Lisa, can you describe the work of your cooperation, please?
Sure, yeah. So first of all, thanks so much for having us here and having us part of this conversation. I think it just really speaks to our partnership and how this whole project has really started with Douglas County. And so the FAIR program stands for Families Actively Improving Relationships. And it is a intensive community-based outreach program for parents who are really struggling with lots of challenges that I think we are trying to address with the Vision for Transformation. So we really hit on some key objectives by treating parents as a whole instead of trying to send them to different siloed treatments. So if a parent gets referred to FAIR, most often it is because they are experiencing complications with substance use. Opioids or methamphetamine is what's most common in our area. But as we know, parents suffer from a range of different substances that they might be exposing themselves or their families to. We also work with parents, though, who are not experiencing substance use, because we know that there are lots of reasons why parents are challenged and that they come to the attention of the system. So that is where we have pre-FAIR. So we have been working very fortunately alongside Jessica and Desta here in Douglas County to bring the full continuum of care for parents who are both at risk for entering into the child welfare system and more downstream sort of involvement with the system, and then those that are already fully down that system. So we have pre-FAIR to FAIR. And what we do is we work with parents on substance use, addressing their mental health concerns, their parenting needs, and then all the sort of other ancillary psychosocial determinants of health that we know really contribute to some of the challenges that families experience. So that might be low education, low employment, housing difficulties. So some of those key challenges that have already been identified from the good work that Jessica and Naja and Desta have been doing together. The FAIR program can help to families navigate these systems and address some of those barriers. So we like to really think of the FAIR program as being a barrier busting program, where what we do, our objective is to bring evidence-based practice in those 4 key areas: substance use, mental health, parenting, and ancillary needs, to each and every family that enters into the child welfare system if they need that additional help. So we're really trying to create equity in the delivery of services for all parents. And oftentimes what that means are some things that are pretty basic, but are also really profound. So bringing services to the families instead of asking families to come to us, particularly in a rural environment. So going and meeting them where they're at. A large majority of parents that get referred to us are unhoused at the time of referral. And so we will meet them wherever it is that they happen to be laying their heads down. We also help them obtain some basic needs. So making sure that there's food, food for them to be able to get some nutrition and some energy to be able to make it through the different tasks that they are working through on their treatment plans. Maybe helping to provide some access to pro-social supports, learning new pro-social activities, getting involved in their communities as well, and really understanding what sort of community supports are available to them. All of that happens with one primary clinician, as opposed to having them meet with a bunch of different service providers, which really allows for some consistency and continuity of care, but at the same time allows us to then work in really close partnership with ODHS. It has been a pleasure for my frontline staff to work really closely with the frontline staff with child welfare. And I think because we started this out with a shared vision, Jessica and I worked together for over a year, meeting with different community partners, really understanding where this was going to fit into their community. And so when we were able to introduce FAIR, we were able to hit the ground running with strong partnerships, strong relationships. And as a result, although we've only been serving families in Douglas County for less than 6 months, we've already been serving a good number of families, starting to achieve great outcomes and being able to see reunification home, which is exactly what our objective is. So thank you.
It's really exciting work, and I'm both impressed and grateful to both of you that you're utilizing assessment, research, evidence-based practice, data to inform the interventions, because it's so in line with our third guiding principle within the Vision for Transformation. So thank you. It's exciting stuff to hear about. Desta or Jessica, before we wrap up, is there anything else you'd like to highlight that's happening right now in District 6?
I don't think so for me. I just really appreciate the work with both Lisa and Naja and the organizations that they're with and the partnerships that are, happening. And, these are just a couple of we have a lot of partners that are really critical in this work, and it really feels like it's coming together nicely. So I just appreciate everybody's hard work at this, and appreciate Jessica and her leadership in our district. And otherwise, I don't think I have anything else to add. Jessica, do you?
Thank you, Desta. I would just echo what you said and just acknowledge that Naja and the CP3 team, they've really been the backbone of a lot of our progress and our efforts moving forward. And we appreciate that work so very much. Naja, you feel like a family member at this point. You're just part of our child welfare team. And same with you, Lisa. You've been incredible to work with. You guys bring so much great energy and enthusiasm to the things that we're trying to achieve here and work on together. So we have a lot of going and a lot that's underway that we didn't get a chance to talk about this morning, but I want to acknowledge both of you on all of that work we're doing together beyond what we talked about. And thank you very much, both of you. You're great.
I want to echo that.
Our pleasure.
Thank you so much for the opportunity. And it's just so amazing to be working with you all. And, it's a privilege for sure.
Well, this conversation leaves me with a great deal of hope for the children and families in Douglas County. I thank you all for being with me today. Thanks for your time.